Mr. West. So I'm providing patient privacy. Hi, my name's Megan. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay, thank you. And do you have any allergies? No, okay. So I'm going to be administering 2 medications for you today. One is ceftriaxone. It's an antibiotic to treat your UTI, your urinary tract infection. Some possible side effects that can occur are a rash or a diarrhea. And then I'm also going to give you a bag of normal saline. Both of these will go into your IV site. And the normal saline is just to replace fluid and electrolytes because you've been sick for the past few days. And a possible side effect of normal saline is swelling in your extremities. Okay, so I'm just going to go ahead and assess your IV site. I'm looking for redness, swelling, heat. And do you have any pain at your IV site? No? Okay, good. That's what we like to hear. Okay, Mr. West, I have your medications. Opened up this new bag of 500 milliliters of normal saline. I've checked the expiration date and I've rechecked my order to make sure that I have an order for 500 milliliters of normal saline. We're going to pretend that there's a blue cap on top of this. That's why my thumb's covering it right now. But I've noted the clarity of the solution and now we're ready to spike. Okay, so I'm making sure my roller clamp is down. I have taken off the blue cap and I'm going to take this off. I'm going to spike the tubing. And I can flip it. And I'm going to fill the drip chamber. And then I can prime. Okay, so I have my 500 milliliter bag of normal saline that I haven't primed yet, so I'm going to prime it. Okay, so I'm going to place it on the hook because we are needing a secondary bag. So I have filled my drip chamber halfway. I am going to make sure the clamp is off right here, and I'm going to slowly unroll and prime the line. Okay, and it's primed. I'm checking for any bubbles, and I don't see any. So I'm going to go ahead and attach this. I have a Kuros cap on here, so I don't need to clean again. Okay. Stop it. Okay, so I'm going to go ahead and put this in the pump. I have my ceftriaxone. We have 1 gram in 100 milliliters of normal saline. I've already scanned it and checked the order again. So I'm going to spike it first. Take off the blue. And I've made sure my clamp is down. Okay, it's spiked. Bring this up here. I'm going to go ahead and prime this line. Very slowly. Okay, it's primed. Okay, so I clean the Y site and attach it. Oh my god, everything's soaked. Okay, so I'm going to select channel A. I'm going to do guardrail IV fluids, 9% normal saline, correct. My rate is going to be 100 milliliters per hour. Volume to be infused is 500 milliliters. I'm going to click secondary. And my secondary rate is, so normally it's supposed to be 100 milliliters in 30 minutes, so we're going to do 200 milliliters in 1 hour. My volume to be infused is 100 milliliters. So before I start, I'm going to recheck all the lines for any bubbles. And then I'm gonna open all the clamps. The one down here, I'm gonna open this clamp and I'm gonna go ahead and press start. Okay, so I have my medication labeled. It says what the drug is, the base solution, and I'm gonna put my initials for added by and the time. And then I'm going to put a label on this tubing and put a label on this tubing saying my initials and the date. Okay, Mr. West, so I have your medication going. I'm going to make sure your call light is nearby. It's right next to you. And if you need anything else from me, please let me know. After I've finished giving Mr. West his medications, I would document the drug, the dose, the route, the time, Mr. West's tolerance to the medication,